Alright everyone, today we're going to be talking about the control panel, so please just act like you know nothing about this and let me teach it to you. So starting off here we have our MS, which stands for milliseconds, and this is the amount of time the exposure is going to be active, and it can heavily influence your patient's dose. One thing to keep in mind here is that not every exposure is in milliseconds. Sometimes they're in seconds, so just be aware there is a conversion out there. Next we have our MA, and this stands for milliamperage. It's oftentimes referred to as your quantity, and it controls the amount in terms of numbers how many photons are going to leave the tube when taking the exposure. This also heavily influences your patient's dose. Next we have the mass/backup timer. So in order to get mass, you must combine your milliamperage and your time, whether that's in seconds or milliseconds. Together, those give you your mass. Changing MA or time can change your exposure to the patient and also the exposure to the IR. When you hear the term backup timer, that refers to the maximum length of time the exposure will stay active when using AEC. One thing to keep in mind when the backup timer is reached is to see how much your mass readout was, just so you know what range of exposure you should be in if you have to go to a manual setting. Next we have kVp. This stands for kilovoltage peak. This is oftentimes referred to as your penetrating power. Sometimes it's also called your quality. And essentially what kVp is how fast or hard the photons are shot out of the tube when taking an exposure. This is the actual punch of the exposure. It can affect your subject contrast, which that's kind of a detailed area, but it changes your grayscale based on how much absorption versus how much hits the IR. If you have a thicker patient, you're going to need a higher kVp in order to penetrate those soft tissues. Next, we have our Bucky selection. This determines which IR is going to be active when taking the exposure. You have a few different options here. You have your wall, you have your table, and you have your tabletop. Obviously, there's several reasons here that you want to make sure you're selected on the right Bucky. If you're using a DR system, your picture is not going to pop up on the screen, and that's because you just tried exposing the wrong image receptor. Another important reason you want to make sure you have the right Bucky selected is because if you're on the table and you select tabletop, your SID is going to be thrown off by a couple inches there. Next, we have focal spot. So there's two focal spot sizes. We have a large and a small, and that is determined by the filament size that's used. Small focal spots have higher sharpness, but they can't handle the high MA settings. So for some radiographs, we want to make sure we have the small focal spot size selected. That way we're getting the most recorded detail as possible. For those procedures that are going to be using a lot of MA or mass, we're going to need to select the large filament size. That way we don't burn up the small focal spot. Next we have density. Density is the thickness of the anatomic part being imaged. The thicker the part, the more absorption will happen. Thicker will require more mass or more kVp. Thicker parts will also create more scatter, which decreases our contrast. One of the most important things we can do to decrease our contrast is using a grid when it's necessary. I would also like to mention, in terms of radiographically speaking, density can also be referred to as how dark an image appears. Next, we have patient size. There are 4 body habituses. The thicker the patient, the more technique they're going to need in order to penetrate them. The thicker the patient, the more technique we're going to need to use. That way we make sure we're still reaching the IR. And typically at most facilities, they're going to have a button. You select that and it's going to come up with the 4 different body habituses. Whenever you select them, pre-programmed techniques should auto-populate on there, which is very nice and very convenient, because even if it doesn't work exactly, it at least gives you a better baseline to work off of. And lastly, we have our AEC selection. AEC stands for automatic exposure control. When using AEC, you want to always make sure you have the right exam selected. AEC is honestly one of the greatest things we've ever seen. However, it can be very detrimental if you're not paying attention to what you're doing. There's a lot of back-end work that the computer does as far as like auto rescaling, and when the machine actually knows to shut off the exposure. If you don't have the right exam selected, you're not going to get the picture that you're shooting for. And another really important thing to remember when using AEC is look at which cell is selected, because you always want to be sure to put the anatomy of interest over the selected cell. I hope this presentation helped you learn a little bit more about the control panel, and thank you for watching.